Hello, my name is Andrea Bocca and I'm here with you today to share with you a lot of insights about a very particular product, which is the Suneco Cell. Why is it different? Because it approaches the cellulite, which is very spread. It is over 90% of the female patients that have it. And it is something that, although it is not affecting directly the health, it affects our self-esteem. So we really needed something that works on it, because we have tried many things throughout the ages which failed to reach the expectations. This time we have something medical in there, because now we have the knowledge. Now we know that cellulite is not a matter of fat. It is a matter of extracellular matrix, unresolved inflammation, and dysfunction of vascular and lymphatic drainage. And now we have again the product that approaches it in a different way, in the medical way. What's inside? Now inside we have three key ingredients. We have a low-weight hyaluronic acid that allows us to stimulate physiologically, not through inflammation, directly the CD44 receptor of the fibroblast. By this, enhance and potentiate the activity in some very important directions. Number one, we create collagen. Others do also. Now, different types of collagen, not only type 1 and type 3, which is now very well spread, now more important types, type 4, type 7, fibronectin, elastin, key things that are missing exactly in the ECM of these patients affected by cellulite. And then we take it further. We have the exact key amino acids that you will need to be able to fulfill this process and that have another activity, an anti-inflammatory, anti-fibrotic activity, which is the key, the medical key inside cellulite. Because again, what do we have in there? ECM. Well, this is the product to remodel it. Then what else do we have in there? Dysfunction of drainage. What is this doing? Angiogenesis. What else do we have in there? Fibrosis. What does it do? An antifibrotic, unique medical way of approaching it. And number three, well, we have something more. This is carbonate and bicarbonate to neutralize the acidic pH that we find specifically in cellulite, and that goes hand in hand with inflammation. So remember, if you want a complete medical approach beyond the aesthetic appearance for cellulite, this is the way to go, the Suneco Cell. But it takes it more. It takes it to the point where we need a specific diagnosis to have the right product for it. Why am I emphasizing on it? Because many times, well, the patients say they have cellulite, but when we actually take a look, it is a matter of fat. So remember, this is not a product to dissolve fat. No, this is a product to medically treat cellulite, but for that we need to know that that is cellulite. Now, how do we make the differential diagnosis between cellulite and a matter of fat? Well, sometimes they even come combined to make it even more complicated. My advice for you is ask the patients what they mostly mind. Because if they will indicate straight the banana rolls, those areas of just pure fat excess under the bud, that is nothing to do with the Suneco Cell, because that is not cellulite. Cellulite is when you contract the muscle and you see the dimples in stage 1. From stage 2 to 3 on, you don't even have to contract the muscle. You really see the dimples on the skin. But then we have another pathology, which is the lipedema, and you know it already. Those are those patients with big amounts of fat, where of course you see every now and then the demarcation, the separation by some fibrotic septa, but it is mostly a matter of the big lumps where it is purely fat. These are not your candidates for Suneco Cell. It is the typical patient with cellulite, especially stage 1, stage 2. The earlier we start, the better it is. So when your patients, again, they contract the gluteus, they contract the lower muscles, you will see the orange skin appearance. That is key to putting the right diagnosis. If it is just a matter of skin flaccidity, for that you have Suneco's body. This is for those lumps and bumps of orange skin, which is the cellulite. Whenever you have doubts, ask the patients to contract the muscle. Take a look if you see the orange skin appearance. That is cellulite. Just seeing some dimples and a lot of fat, that is not cellulite, that is lipedema. So make sure you have the right diagnosis to start with. So take a look at your patients, be sure, do the correct diagnosis, check the orange appearance, because if your patients are bothered by the banana rolls, which are a matter of fact, or if they have a lipedema, this is not the right approach. This is for cellulite. So start by checking it, knowing that that's in there. And if the patient has cellulite, stage 1, stage 2, stage 3, even stage 4, except for the sclerotic part, this is the right way to go with sustainable, safe, and efficient results. Try to love it.